Hello everyone, in this video we are going to study schizophrenia. Schizophrenia is a very common psychiatric condition which is characterized by one or more episodes of psychosis. So, to understand this disease, we have to define its symptoms. So, the symptoms of this disorder are majorly divided into two core categories, that is positive and negative. So, positive symptoms include delusion, hallucination, then abnormal behavior and catatonia. Negative symptoms of this condition includes emotional flattening, then anhedonia, followed by social withdrawal. Apart from these core symptoms, we have cognitive impairment associated with the disease, which is attention and memory impairment. So, apart from the above characteristic, there is another one feature, that is defect in selective attention. This does mean that the person is or the patient is not able to differentiate between the familiar and unfamiliar stimuli. This can be very well explained with the help of one example, that is tickling of clock. We know that as soon as we enter in the room, the normal person will get easily accommodated with the sound of tickling of clock, but for the schizophrenic patient it will be irresistible and irritating. So why this condition happens or why these symptoms appear, so we have to study pathogenesis to understand this. Starting with the pathogenesis, the pathogenesis is divided into number of factors, starting with the genetics and environmental factor, which include the mutation in neuroguanine, dysbindine, DISC1 and TCF gene. All these genes are associated with the functioning of NMDA receptor, that is expression, trafficking, etc. So, if there is a mutation associated with this genes, then it will cause abnormal glutamatergic transmission, and it is also seen that there is a reduction in the function of NMDA receptor. NMDA is an inotropic receptor for the glutamate. NMDA stands for N-methyl D-aspartate. Then the second factor is neurodegeneration. The neurodegeneration is associated with the neurotoxicity, which is due to the hyperactivity of glutamate. So in first factor we have hyperfunctioning of glutamate, and in second we have overactivity of glutamate. Third factor, which is important one, is neurochemical factor, which include two neurotransmitters, that is dopamine and glutamate. So starting with the dopamine, it is found that there is a dysregulation in the dopamine pathways in the certain areas of brain. So there is dysregulation or dysfunctioning specifically in mesolimbic pathway and mesocortical pathway. The mesolimbic pathway originates from VTA, that is ventral tegmental area, and it ends in limbic system, specifically in nucleus accumbens and amygdala. This pathway is responsible for regulation of mood and emotion. So, if there is an hyperactivity of this pathway, which is stated by various facts, that if there is an increase in release of dopamine via some drugs like amphetamine, cocaine or bromocriptine, or if there is an increase in the level of dopamine synthesis by giving higher amount of dopamine, it will lead to schizophrenic like behavior. And if we antagonize this dopamine activity, then it will show improvement in the symptoms. So specifically this mesolimbic pathway, hyperactivity of mesolimbic pathway is associated with the positive symptom. Then we have mesocortical pathway, which originate from VTA and terminate into cerebral cortex, and which control the attention and decision making. So hypoactivity of this pathway is found to be associated with the negative symptoms, which is second core symptoms of schizophrenia. So both this pathway is controlled by dopamine, and the receptor of dopamine which is involved in this condition are D2. So if we are targeting D2 receptor or we antagonize the D2 receptor, then it is found that there is an improvement in positive symptoms because of blockage of hyperactivity, but there is an worsening of negative symptoms because of again hypoactivity. The next is glutamate. The antagonism of NMDA receptor found to improve both positive and negative symptoms. This is because the glutamate controls the positive and negative symptoms via a different way. So NMDA reduces the activity of mesocortical system, which leads to negative symptom associated with the schizophrenia. And along with this, NMDA also control the mesolimbic pathway, as NMDA reduces the GABAergic inhibition over the VTA. So VTA will be continuously in excited state. So this will lead to activation of mesolimbic pathway and leads to positive symptoms. So these are two neurotransmitters which are involved in the schizophrenia condition. But we cannot target glutamate, since if we are antagonizing the glutamate, then it will be affecting the synaptic plasticity. So the major target we have is D2 antagonism. If you understand the concept, then please like and share the video.